my whole life is in a state of flux. Everything's half finished and everything's in the progress of getting done, because I just do bits and pieces here and there and try to get the best out of what I have for the day.
Troy Pattons had to get used to spending a lot of time at home. He was supposed to have a hip replacement 12 months ago. He's now been waiting 2 years.
It got to the point where it's not, am I in pain, it's how much. All I do is sit by the phone and wait for someone to let me know I can have my life back and give me a hip replacement.
Although Troy's surgery is considered non-urgent, he's had to stop working because his pain makes almost everything difficult. This is about as active as he gets.
It's just surviving now, and it's just missing out grandkids.
Troy is one of thousands in Victoria whose surgery was suspended during the pandemic. Continuing pressure on hospitals and staff shortages saw the state's elective surgery waitlist blow out to 87,000 by the end of June. That's an increase of 21,000 in a year. The Victorian government says it's spending $1.5 billion trying to catch up on the backlog.
It's important to understand that surgery is not optional. These are people that are in pain. These are people that are having effects into their activities of daily living. It's also causing a lot of stress to them, but it also affects the rest of the health system. Will that surgery then become an emergency surgery?
This problem is not limited to Victoria. In New South Wales, there are more than 100,000 patients on the waitlist, nearly 19,000 of which are overdue for surgery. In Western Australia, there are 33,000 waiting, and while there's no current restrictions on surgery, that waitlist has grown by 10% during the past year. Tasmania has reduced its waitlist, and in Queensland, there are almost 58,000 on the waitlist, 7,500 of whom have waited longer than recommended. Diane Hill is one of them. She was first put on the waitlist for cataract surgery about 13 months ago, recommended to occur within a year.
I can drive still, but I'm on the cusp. I'm very concerned about what will happen if it progresses. You know, I'm on my own, single, no one to look after me. And I am having issues. I've got a magnifying glass I have to use to find out what I've got to do, what the instructions are.
Last month, she was told she was still on the wait list, and she again faces a wait of up to 12 months.
One of the letters I've got was sent to me in July last year that they would expect something to happen within 365 days. And of course, I've just got another one of the letters saying exactly the same, another 365 days. My doctor and my optometrist have written to the department asking, you know, them to prioritise.
Whenever you have a logjam in one area of the health system, it affects all areas of the health system. What we're seeing currently in Queensland is that Category 3 outpatient department referrals have been postponed. So patients are still going on a wait list, but those wait lists are going nowhere. So they're just basically getting longer and longer and longer.
A Queensland Health spokesperson said 32,000 elective surgeries were completed last quarter, despite the pressures of COVID and staff shortages. They added $15 million will be spent to improve waiting lists long term.
If we do leave people on the waiting list for a couple of years, say, the condition they have is likely to get worse. That's going to be more difficult down the track for not just the patients, but the system.
Jeffrey Braithwaite says it will take a variety of measures to get on top of wait lists.
Prioritising people on the list and really looking at where is it that we would provide the best care, the best value care for conditions. We could triage the patients better into the system. We could optimise the public and private hospital nexus. The public hospitals are often jam-packed and under huge pressure. Sometimes the private system has some capacity.
But those left waiting need more urgent help.
I'm still lucky I can get out and about and, keep up with some of my hobbies and activities. I'm concerned that I won't be able to take photos the way I've been doing. My fear is that my life will change dramatically.
It's hard on your mental state. Am I not worthy? Am I worthy? All these things go through your head. And then you start thinking, it's a couple of society that's going to throw me away and they've finished with me. Where I have a lot more to give.